I think it's important to give back to Lupus Europe members. And for those of you who hadn't the pleasure and privilege of being at ELM, let me tell you a little bit about some of the work we've been doing. So, one of the things that we did recently was that we looked at how social determinants of health, that's essentially how you live and how you grow and everything that surrounds you during those moments in your life, how they affect your lupus outcomes. And the way that we did this is that we collaborated with these amazing people from the Karolinska Institute in Sweden, and we used nationwide registry data, and we showed that there's an association between having a lower income, a lower level of formal education, and, for instance, living alone with worse lupus outcomes in the shape of worse disease damage and even mortality. And all of these things, at least in Sweden, happen quite early after diagnosis, which is very surprising. So, based on this, and the fact that this data was limited to Sweden, we tried to see what was out there for other European countries, because there's a lot of data on this topic from the United States, but hardly any other data from any other place in the world, actually, not just Europe. And of course, some of you may remember that Lupus Europe ran two very, very nice surveys that probably reached some of you who are watching right now. And the first one from 2020 surveyed over 4,000 lupus patients from over the entire continent of Europe, which is amazing. And so our thought was, can we look at this data and see if there's anything in it that could help us look into how social determinants of health interact with lupus? And so we did. Now, it's early stages in the analysis, but some of the work that I took to ELM 2026 was a reanalysis of the survey, looking at specifically at your income level or reported difficulty with paying your bills, which we used as a proxy to economic level, and also your reported formal education level. And we tried to see how it correlated with having your lupus under control or not, which was the question that was asked in the survey. But we did find a very, very clear connection between having more and more and more difficulties paying your bills with the not having lupus under control, actually. And I think this really supports the data that we have just now published about Sweden. And it takes that and it shows that this is a reality across Europe, not just in one country, but across countries in the north and the south, east and west, across multiple health systems. And so this really is something that we need to look at and be mindful of.